One of the aspects that made it very exciting for me, this particular meeting, is the power of the humanities to convey the emotional component of what we are living. And I got conveyed to me in a way, in a statistical and an emotional, by someone that works at the MGH. And I was in a meeting organized by the Vatican, and there was this physician that said, for the first time, we do not have problems or getting organ donors at MGH because so many people are dying from overdoses. And to me, that was chilling. It gives you an idea of the statistics and it gives you an idea of the narrative. Because we have to face it up front. The opioid crisis, which is the worst we've ever seen in terms of the number of mortality in a relatively short period of time, was driven by the health system. Our healthcare system is responsible for the crisis.
We're here because we know there's an epidemic. We know 65,000 people a year die from the opioid epidemic. But I do want to make the point that we've actually had a lot of people die from opioids for a long time. 2010, about 40,000 people were dying from opioids, and that's more people than died at the peak of the HIV epidemic, motor vehicle death epidemic, or firearm epidemic. And that was 2010, that was like 8 years ago. And I would challenge us all to think about how much attention we're paying to the issue back in 2010. And the answer is, not that much. I mean, a lot of people in the field were paying attention to it, but in the broader conversation, it was just never there. So number one, this is a real issue epidemiologically, and but one that's been an issue for a long time, and we really haven't been paying as much attention to it. One of the big puzzles for me, and I think there's a good book to be written about this, as to why we haven't paid as much attention to it broadly earlier than that.
Possibly. Certainly one major culprit is the nature of physical pain itself. Physical pain is something that when you have it, you have absolute certainty that you have it, and yet if you stand outside the body of someone who's in pain, you often don't even know they're in pain, and you also have a very difficult time assessing the intensity of it.
Divided time in divided country, health is probably one of the only universal values. It's not a red state value, it's not a blue state value. Everybody wants to be healthy. So we should act accordingly. We should demand health. We should demand governance for health, that government action ultimately is going to promote health on all its axes, that cross-sectoral corporate action, private sector, public sector action, all promotes health. Ultimately, unless we demand health and we understand what it is that causes health, and we had a lot of conversation about that today, we will not get it. And this is something that is sorely lacking in the American conversation.
Simply say, remain calm and be level-headed about it. There's recent data that shows that in certain localities we're about to peak with the overdoses. We can expect a decline. These are classically how every drug epidemic, since we've been keeping data, has happened. Unfortunately, I can tell you as a historian, this is usually the moment where we pass the most draconian drug laws. 1986, crack cocaine was in decline. Rockefeller drug laws in 73, heroin was already well in decline by then. So now the moment is to just be calm. We do what we can. We do the prevention work. We get people into treatment where they want treatment, where the treatment works. But we don't do anything rash when those measures don't work immediately the way we like them to.